Other complications like um, you have you have bruising. Yeah, it can happen, can cause bruising, so, or hematoma. So this is now due to the to the to the puncture site, no? So this is the most common, complication of this procedure, no? This is a building of blood under the skin. This is because there is a leak of blood at the puncture site. So this usually resolves on its own, but this is a little dangerous when it comes to post procedure, because if there is a what we call if there is a increasing hematoma, so if there is a increasing hematoma post procedure, so this means there is a ongoing bleeding, so that is a red flag. Okay, so it means there is a worsening bleeding at the insertion site, or the post insertion site. So you have to inspect. Okay, you have to inspect, then you have to apply pressure on the site. So what to do is you apply direct pressure at the site. So for precautions, make sure you wear your gloves, no? You wear gloves. Then inform the healthcare provider. So assess the vital signs and check for peripheral pulses. Okay, check for peripheral pulses. Okay, next is, let's talk about infection. Pero then again, what I've told you before, when you talk about infection post surgery, okay, always remember that infection is not the priority, or you will not expect, you won't expect infection within 48 to 72 hours. Okay, don't forget that. Don't expect infection during the first 48 to 72 hours. So infection always is determinable, or can actually assess and see infection after 72 hours. Okay, so infection in 72 hours. So never expect, or your never pick infection as a number one priority. It is within the first 24 hours of the surgery, the procedure. Another complication would be arrhythmia. So another complication would be arrhythmia. So arrhythmia. So arrhythmia. So why arrhythmia? Because of during the procedure, you are actually manipulating, you are actually inside the coronary arteries, no? This might cause irritation and cause arrhythmia. So again, you're inside the heart, inside the coronary artery, no? And you might actually irritate the muscle, especially your myocardium, then probably cause arrhythmia, probably cause arrhythmia. So another complication is you might cause, as I've said a while ago, the dye. This causes nephrotoxic. This is nephrotoxic. This is bad for your kidneys. So you might have kidney problem. So, or kidney damage related to the contrast media. So related to the contrast media, or the dye. Okay, the dye. So again, so never forget to, okay, so as nurses, always mind or monitor for signs of arrhythmia. So arrhythmia, always check the cardiac monitor, check and observe the cardiac monitor. So if you see PVCs, premature ventricular contraction, you have your PVCs, and ventricular tachycardia, Okay. If you see SVTs, supraventricular tachycardia, so don't wait until you see ventricular tachycardias or SVTs. That would be worst. So the first thing that you would see when your heart is irritated is, first, it will show PVCs, premature ventricular contractions, or even APCs, no? Premature atrial contractions, I mean. So PACs, you see PACs on it, like, or PACs, premature atrial contraction. A heart attack can cause during the procedure. So a MI, or a heart attack. So this can happen during the procedure. So nurses should monitor if there are signs of chest pain. So monitor for chest pain. Okay. Your patient will probably manifest no, you can see it if with the facial grimace, or eventually your patient will probably express, no. So facial grimace, so you have facial grimace, your patient would be restless, agitated, be restless, agitated, and probably your patient would verbalize, no, would verbalize the pain, because mostly when we do coronary angiogram, coronary angioplasty, the patients are awake, they are actually awake.